This video is about treating herniated discs in our clinics. A normal spine will have one vertebrae on top of the other. In between each vertebrae there is a disc. And the disc is like a jelly donut in the sense that the outside of the disc is thick and the inside of the disc there's a jelly. And the jelly gives stability to the spine. We have videos about the anatomy and you should go watch those because it's very important that you understand the anatomy. But what happens with a herniated disc is the jelly comes out of the disc and pushes into the spinal canal. That's called a herniated disc. It'll sometimes pinch the nerve, sometimes pinch the spinal cord. It can be sort of a severe pain. And we did a study in 2007, and what we found in our study is that we can eliminate herniated discs. We had a patient come in after we did our study. His name was Alan Gill, and he said, I heard you're treating herniated discs, and I have a herniated disc because I've had it for years and I've learned to live with it, but if you can help me, I'd like to have help. I don't want to have surgery. I'd like to see if we can get this better. So when he came in, we did an MRI. And with his MRI, what we found was his nucleus was pushing into the spinal canal. This is the herniated disc right here. Now, it is a large herniated disc. And when he came in, he said, can you help me? I said, well, we can make it feel better. He said, can you eliminate the herniated disc? Well, at this point in time, we hadn't seen a herniated disc that big. So I said, well, we'll make it feel better, and we'll do some MRIs, and we'll check our progress as we're going. So he went through some treatment. We did an MRI. He was feeling better. He wasn't perfect, but he was definitely feeling better, and we could see that about 70% of the herniated disc was gone. So he was definitely on the road to recovery. So we decided to do another month of therapy, and as we put him through the therapy, he felt great. There was a day he says, you know what, this is the best I felt really for a long, long, long time. And at the end of his therapy, we did a third MRI, and on that third MRI, you can see now the herniated disc was completely gone. So at this point in time, this was the largest herniated disc we'd ever seen. A good portion of that herniated disc was pushing into the spinal canal, and he did get better. So the point of this is, if you have a herniated disc, you need to give us a call and come in. We'll do the evaluation. If you don't have an MRI, we can send you for an MRI. We can get an MRI to see exactly what's going on in your side of your spine. It's important to see these things. So give us a call, make an appointment, and we can work on your herniated disc. Thank you.